Hidden Helix, pros, cons, advantages, disadvantages. Going to go through 5 of each. Also going to go through what you should know beforehand, preparing for it, getting the piercing done, healing, jewelry, living with the piercing, and what happens if you say, I'm done with this. Coming up next on Pros and Cons by Piercer, Season 2, Episode number 87. For those that are new to the channel and those that want to hear it again, welcome to the Body Piercing and Tattooing channel. Hope you enjoying the videos. Hope you find them helpful and useful, but you may not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. Piercing we're going to talk about today is the Hidden Helix. It's hidden in the helix. This is a piercing that's done really like a very high helix piercing, or even in some cases a vertical helix piercing, and done in a way that the jewelry is kind of hidden behind the flap of the helix, and at the top kind of folds over, and then a dangly thing hangs from it. So it looks like it's hidden, or it's floating in midair in the land of illusion. History. This piercing, it's a modern idea because we really didn't have jewelry like this 20 years ago. But the location, the piercing that's done, where it's done, etc., has a long, long history that goes back probably to the beginning of time or recorded time. It's a common place to get pierced, the upper ear helix area. This is not really that crazy or wild, but it's different. Now let's get into the pros, the advantages, the things that make you go, yes, I need that. Starting with number 1, if done correctly and with the correct jewelry, it'll appear like the jewelry is just kind of floating there, that it's not connected to anything, that it's magical and weird and unique. Part of that will come down to whether or not you have the right anatomy to let it hang. Number 2, can be hidden. Because that flap hides where the piercing is actually at. If you have a situation where you can't have that visible for whatever reason, you could probably still put a very basic piece of jewelry in there, like a labrae stud with like maybe just a ball on it or a disc, and easily hide it behind the helix so that no one would ever know that you had it unless they saw the back of your ear. Number 3, widely socially acceptable. Ear piercings are just one of those piercings, unless you're doing something really, really crazy, like maybe not even crazy, a little bit more out there, like an industrial or something wacky or wild. They're pretty socially acceptable, and they're easy to hide with hair. People really don't. It's not going to be a job stopper or anything like that. People kind of are used to them. But this one, they might go, I've never seen that before. That's really cool. Which gets us on to number 4. Very rare and very unique. You have to have the right anatomy for this. If you don't, it ain't going to work. Also, for that reason and the fact that it's a fairly new thing, it can be a very unusual piercing. It's not something you're going to see every day walking down the streets of any major city. It's something that you're not going to see very often at all. So it's kind of a I got this and no one else does kind of thing. And number 5, long history of healing. Helix piercings will heal fairly. They can be a little grumpy. It can take a little bit of dedication, but for the most part, they do heal. And that moves us on to the cons. The disadvantage, the things that make you go, no, not doing it. Number 1, you may not have the correct anatomy. Even if you place the piercing up there in the right spot and everything, if you don't have that flap that kind of covers it, it's just not going to look right. You're not going to have that illusion of just the jewelry kind of dangling out there in space. It's going to be, people go, yeah, there's a stud right up there, and then the jewelry comes down. So it's not really hidden. It's just a helix, which is fine if you're okay with that. That's great too. Helixes are great too. Number 2, swelling. These piercings can swell quite a bit. They go through phases of swelling. Which means you have to have longer jewelry to begin with, and it's going to need to be downsized. So there is an additional kind of thing, and it makes it very important to isolate it. Which brings us on to number 3, can close quickly. This piercing, if you take the jewelry out and leave it out for an extended period of time, can close on you. Not so much as maybe an oral piercing, but it is up there. It's not really, it's a piercing you definitely want to leave jewelry in. Number 4, can't sleep on the piercing. Because of the location and the flexibility and pressure and etc., especially during the healing process, you really can't sleep on this. Even after the piercing is healed, you may find sleeping on it a little not enjoyable. Also, you have this thing that dangles off of it that increases your likelihood of getting snagged on stuff, depending on what that setting is. And the last one, number 5, sensitive to trauma. Kind of already mentioned this, or kind of saying the same thing, but this piercing, even after it heals, can be sensitive to pressure, blows, helmets, etc. It's just one of those piercings that does not like to be messed with. And that moves us on to preparing for the piercing, or what you should know beforehand. The first thing is, if you're employed or involved in an activity, sporting, cheer, what have you, or you have an upcoming event where it's not going to be appropriate for you to have that piercing, or or anything that has a dress code, you really want to check ahead of time before you get this piercing done. This one, like I said, you can hide it possibly by changing the front, so that might not be an issue, but it's really always something you need to consider when getting a new piercing if you're involved in any type of activity where they might not like you having that piercing or allow you to have that piercing. Nobody wants to be in that situation where it's, you don't get to do this today unless you take the jewelry out, because nobody wants to take the jewelry out after you've got this great piercing. Why would you give that up? Next thing is, you want to consider and find a piercer that is well experienced, professional, makes you feel comfortable, passionate about what they do, informative, willing to educate you, willing to answer questions, and has been around for a while and is going to be there to support you. Also, somebody that's going to take the time to go through a consultation with you, explaining what it's going to take to heal it, any changes in lifestyle, cross-contamination prevention, risk, etc., before they do the piercing, and then go through the aftercare instructions with you. Next thing is does a piercer go through a consultation? Of course, as I mentioned earlier. What is their deal with aftercare? Do they go through an explanation in verbally? Do they offer it in writing with your jewelry size, when it was done, who did it, and what your minimum healing time is? So you have some information if you need it to reference, along with written instructions. This is important to go through it verbally, in my opinion, so you have that opportunity to ask them if something comes up and you're not, for clarity. Next thing you want to consider is the jewelry material of a biocompatible material. Is it a metal that you're not going to have a reaction to? This is especially important if you have any type of sensitivity to things like nickel. Know beforehand whether or not the piercer supplies that or not, or what is going to be best for you. This piercing will demand isolation during the healing process and possibly afterwards. Plan ahead. Plan on not sleeping on it. Kind of train yourself not to sleep on it, or find an alternative like one of those neck pillows, the kind of U-shaped ones, and then put a clean sock on it so you have it so you can sleep with your ear in the center of it. Also, figure out a way, if you are involved in any type of activity that involves helmets or safety gear in the area, try to figure out a way that's not going to cause a lot of impact on that piercing. Or do it during a period of time when you are not doing that activity to give the body time to heal the piercing before you do that. Next thing, cross-contamination prevention. Common sense stuff, and I'll go through that in depth. But this can take some lifestyle changes in some cases, maybe doing things a little bit different, postponing vacations, etc. It's a good idea to kind of get an understanding of what it's going to take to heal this piercing beforehand so that you're prepared for it. This piercing may take up to a year or longer to heal. Cartilage piercings or piercings through the cartilage can sometimes take a very long time to heal, mainly because there's not a lot of blood supply. So you should be ready to dedicate and make that commitment ahead of time. So think about that before you get it done. This piercing demands isolation. I've kind of already talked about this beforehand, but plan ahead and avoid contact. If you're going to be doing anything that may involve contact, postpone it or postpone getting the piercing done. And that moves us on to the piercing experience itself. Most people on a scale of 1 to 10, they will say this is between a 2 and a 4 as far as pain. Not a very uncomfortable piercing to get done. Usually there's a little bit of heat involved with this one, but that's about it. First thing you're going to do is a consultation where the piercer will explain what you're getting yourself into, the risks involved, what it's going to take to heal it, check your anatomy, ask you about any type of medical issues or problems you may have, and then you'll move on to jewelry selection. With this, there's going to be probably post-style jewelry, probably a labrae stud that's too long to allow for swelling. The fronts can be a lot of different things. In some cases, picking something simple that fits underneath the helix may be a better option for healing it than having that dangle there the whole time. Then you're going to fill out a waiver. This is going to ask questions about health. It's going to ask questions about your age. It's going to ask you to give consent to get it done. It's going to ask about any medications you're on and whether or not you're intoxicated and all kinds of other fun stuff. Be honest with us about all this, because all these things can affect how the piercing experience is and what the healing experience may be. So be honest. Next up, we'll set up in all our tools, get everything ready, disinfect the area, mark it. Now, marking is kind of a collaborative effort. With this one, you have to kind of use your imagination a little bit of where that jewelry is going to be and how that's going to hang down. There are things we call simulators. Not stimulators. Simulators. They're like a plastic stick that we can stick those ends in and kind of get an idea of where it should be. Sometimes we'll do this during jewelry selection, so we'll already have kind of an idea. It's not a bad idea to maybe at least have a basic understanding of where this is going to be before you do it. But this is one of those ones where the piercer just you have to trust them. Because you can't see the side of your head, it may not be a bad idea to have the piercer or your friend take a photo of it so that you can see it easily. And know exactly how it's going to sit in there. If you wear glasses on a regular basis, it's a good idea if you don't have them on that you take that into consideration of where that piercing's placed and whether or not it's going to affect and get knocked around a lot by your glasses. Once we're all set up and ready to go and it's marked, we will go ahead and put you in a position to do the piercing. I'd like reclined. Inject the needle in and through. The needle is usually pushed out by a guide pin. The jewelry is hooked in the back, pushed through, and then the front is put on. We stop any bleeding that may occur, clean you up a little bit, and we're done with that part of it. Next, of course, we'll do our cleanup with put on a fresh pair of gloves, do cleanup and all that stuff. Aftermath, usually you'll have a little bit of throbbing and aching immediately afterwards, maybe some heat. That usually goes away in a few minutes. Then it's just going to be tender to the touch. Anytime you bump this thing, sometimes some of them feels like even if the wind is blowing too strongly, it doesn't feel good. And understand that a lot of this is your body saying to you, I'm doing work here. Please leave me alone. Don't mess with it. There might be some slight to moderate bleeding immediately afterwards. Usually not a lot with these. And it can be avoided by candling the ear, where you take a flashlight behind it and make sure you're not hitting one of those veins. Not always necessary, but it's not a bad idea. Usually stops in a few minutes. And then basically the jewelry is going to be loose. It's not going to fit directly tightly. That's for the swelling. Understand that beforehand, that it's going to look possibly a little bit different, the piercing well, right afterwards than it does when it's fully healed and you downsize, or even when you downsize, which may not necessarily be fully healed. Now let's talk about healing. Healing on these averages, I usually say a minimum of 3 months up to 6 months to a year. During which time you want to clean twice daily using a sterile saline spray. Personally, I like Neomed's Piercing Aftercare. Comes out in a fine mist. Very easy to use. You just spray it directly on there, leave it on for about 5 minutes, and leave it alone. If you cannot find, or your piercer doesn't provide that style, you can find comparable stuff on the market. The main thing you want to look for is that it's in a can. It is under pressure. It's not a pump bottle. It should say sterile on there somewhere. And when you turn it over and you look at the back and you start looking at the ingredients, it should only say water, purified water or filtered water, and sodium chloride. There shouldn't be any weird chemical names there. There shouldn't be Himalayan sea salt and all this other nonsense. The only reason why any of that stuff would be in there is if it's not in fact sterile and in a sterile state. And they had to add some food preservatives to make sure it doesn't go bad. So if you get the kind that comes out as fine mist, you just spray it directly on. Some of them come out like a super sucker. It's a powerful stream that comes out of there, and it comes down to the nozzle. If you have that type, your best option is to get some of the sterile gauze sponges. The 2x2s by Johnson & Johnson are my favorite. Just open it, spray it to the point where it's damp, lay it against the area, let it stay in contact for about 5 minutes. And then afterwards, in both cases, just leave it alone. You can let it air dry. I know some people will tell you to wipe it and all this other stuff. Really, to be honest with you, that isn't completely necessary and can lead to some problems, mainly because when you tell people to do that, the first thing that comes to their mind is Q-tip, and we don't want to use Q-tips on this. Now, the other thing I suggest, that you do twice daily with the saline. The one thing I do suggest also is at the end of your shower, pull your hair and everything out of the way and let the water flow over the area for about 30 seconds. What we're doing with these two things is removing that hardened discharge that collects and deposits on the jewelry. The reason why I want to remove it is when the jewelry shifts or moves, it can agitate it, which can hurt and not feel good. And also, we need to make additional room for additional discharge. If you feel like it's not coming off or there's an obsessive amount of it, see your piercer. Have them clean it for you and take a look at it and make sure there's not another issue going on. Do not run to the medicine cabinet and start pulling out everything tipped in cotton or with a sharp point or somebody suggested on the internet and start digging around in there. You're going to cause problems. Do not spin it, rotate it, move it, leave it the hell alone. There is no reason why you would have any contact with this piercing during the healing process. Swelling can last anywhere from roughly about 3 to 5 days, sometimes a little bit longer. The best way to reduce the amount of swelling you see is to avoid contact with the area. You can also sleep with your head elevated above your heart. That will help. But mainly it's isolating the piercing, keeping things away from it, like hair, clothing, helmets, hats, sleeping, don't sleep on it, pillows, Afghans, everything else. And, of course, your fingers. Do not play with the piercing. Now, you want to practice cross-contamination prevention. Common sense stuff. Wash your hands when you handle it. No oral contact or exchange of bodily fluids on, near, around the piercing. Keep your environment clean. Clothing, bedding, towels. Do not submerge the piercing in bodies of water you can't control the quality of. Meaning, do not go swimming. I don't care how long you've had the piercing. If it's not healed, it is an open wound. And if you're swimming somewhere, you are submerging your body in a body of water that is large enough for you to submerge your whole body in and move around. It's going to be filled with microorganisms. One of these organisms could work their way into the piercing and cause an infection. It is always best to wait until the piercing is completely healed. The other problem could be the water kind of collecting in that area that could be caused by excessively swimming. Keep pets away from it. Don't let them sleep in the bed with you, especially smaller animals like to sleep up by your face on the pillow. The other thing is make sure your hair's dry before it comes in contact with it. Wear it up in a fun bun or one of those Swami towels. Wet hair, not only is it more active when it comes to fungi and other microorganisms, but also it can kind of create this wetness that can lead to issues. Avoid contact with unclean objects, things like hats, helmets, over-the-ear headphones, telephones, etc., glasses. Make sure they're either disinfected on a regular basis or completely avoid contact. Avoid playing with the piercing. I've said this before, but let's say it again. It is not a fidget spinner. Let it heal. Leave it alone. First 3 to 5 days, you might see a little bit of redness, discolorization, tenderness of touch, inflammation, and even some slight bleeding off and on. That's probably normal. If you start seeing a lot of bleeding later, like in the healing process, and it's usually first thing in the morning, you're noticing this blood, it means you're rolling over on it and sleeping on it. Stop doing that. Now let's move on to jewelry. Jewelry should be left in at all times, only taken out to replace. I do suggest downsizing a shorter post if it was pierced with a longer post like it's supposed to, and roughly about 6 to 8 weeks. However, after that, you pretty much want to just leave something in it only to take out to replace. Piercings, they do best when jewelry's in them. They'll last longer. Leaving jewelry out for a period of time and then putting the jewelry back in, there's always a possibility of that hole shrinking a little bit, and then you go to force that jewelry back in and you cause damage. So it's usually best just to leave the jewelry in. For the first year or so, it's not a bad idea to have your piercer do it for you. They have the proper tools and the proper methods to do that, and they can kind of walk you through how the best options to do that. Always ask questions if they can give you advice on how to change jewelry. With this particular piercing, the best version, or what I would suggest or do the piercing with, would be a flat back titanium, implant grade titanium alloy labret stud, which has a flat disc on the back and then a post. Front would be threadless with a various different designs. There's a lot of different designs. These could be done with threaded jewelry. The only main difference as far as aftercare and etc. is I would suggest weekly making sure that that ball's on there tight. If it's threadless, really no reason to check it. The worst that could happen is it gets snagged on something and pulled out. And usually in most cases, the amount of force it takes to do that, if it was bent properly, would have probably caused damage to the piercing. So it's not really as big of an issue and not that common. Now, if you have a medical emergency or you have to go in for surgery or some type of scan and they're not going to allow you to wear jewelry in it and the piercing, glass is a great option. It's not the most comfortable jewelry in the world, but it will keep the piercing open and doesn't react to all the things they're worried about. Like, it's not going to be conductive. It's not going to show up as much. Glass jewelry is your best option. Plastic, I don't really advise acrylics and etc. because we don't know exactly what it's made out of in most cases, as in all of them. Living with the piercing. Living with the piercing, you do want to check the ends if you have threaded jewelry on a regular basis. I usually suggest weekly. Leave the jewelry in indefinitely. There's no only taking out to replace. If you notice any sudden swelling or discomfort, it's not a bad idea to stop by your piercer and have them take a look at it and make sure there's not something else going on with that. Like I mentioned earlier, sometimes even a slight tear and you introduce a foreign pathogen, you can get an infection, or if you cause enough damage to the piercing, you may need longer jewelry or what have you. So it's not a bad idea if you bump it really good and it gets a little grumpy, go see your piercer, have them take a look at it and advise you from there. Lastly, let's talk about abandoning the piercing. If the piercing is healthy, there's no signs of infection, no issues, and it's either healing or healed, removing the jewelry shouldn't be an issue. If it's still healing, I would suggest monitoring the piercing area, making sure there's no signs of infection or what have you, just like you would if you accidentally poked your hand or any other puncture wound on your body. If there are signs of infection or other problems, I highly advise going and seeing your piercer or a medical professional before removing the jewelry. The reason for that is how your body heals infections and what happens when you take the jewelry out. Your body heals infections by pushing infected tissue and fluids out. Well, first it isolates it, then it pushes out through the hole, the wound. What can happen with a piercing, because it's a puncture wound and some of them are very long and deep, is you remove the jewelry, and the only thing keeping the jewelry open was the holes. They seal shut, trapping that infected tissue and fluids inside that abscess or cyst, and then you're off to see a physician, have it lanced and drained before it possibly causes problems. If you leave the jewelry in, it allows that way for your body to kind of push that infected tissue and fluids out of the body through that open hole. It's a good idea to just seek some medical advice if you think there is an issue before you take it out, or your piercer, just to be on the safe side so you don't have to go through all that. Now, one thing I always like to talk about on these, because it comes up often, if you notice the stuff that comes out of that piercing after you've abandoned it, when you squeeze it, this yellowish white stuff comes out that has the consistency of cream cheese and smells like a dirty belly button, don't worry about it. That's what is sebum. It is an oily, waxy substance that your body produces to oil your hair follicles, and it also helps with keeping your body watertight or waterproof. It tends to collect in crevices and areas of the body, mainly around scar tissue, because it also helps to kind of lubricate it and help with elasticity. So it's not uncommon for it to collect in piercings. If you ever had a situation where you had large, thick gauge jewelry in your ear or anywhere else, you probably experienced this stuff before. It's not harmful. It's not something to worry about. Just clean it off with some warm water and soap, and it should be fine. Also, stop squeezing it. There's no reason to squeeze it. I don't know why you do that. Well, that's it. Have you had a hidden helix piercing? What was your experience like? If you haven't had it and you have some questions about it, and I didn't seem to cover it, please leave a comment in either case. Till next time, here's hoping all your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I would love to see you for your piercing needs in the future. Have a good day, everybody. Take care, and we'll see you in the next video.